So it's now time for our roundtable discussion. So I would ask all speakers to turn on their mics and their cameras if they could. And we're hoping for this discussion to centre around the potential for a hybrid model of online, in-person community food projects moving forward. There's also a question about presentations being available afterwards for participants to look at, and I think that is going to be possible. So yeah, I think we're all back on board. So can I just open the discussion there, and if anybody would like to jump in relation to going forward post-COVID. I know Maeve Hinchin has a question in the question and answer there about post-COVID moving forward. What do speakers see as the best model moving forward? Is it an online model? Is it a physical model? Is it a hybrid of both? Are there any views on that? Who'd like to kickstart?
I'll come on there, Kevin. I feel for the project that I had delivered with Transform Your Child, I feel that there's possibility for a hybrid model. I've seen the success being around that flexible approach for parents and for families. I think one of the key benefits of having a face-to-face delivery is that we can engage better with families in a practical way than cooking. But the nutritional content and how we deliver that, I feel could be definitely delivered online, and then maybe the follow-ups in a physical cooking sense could be better delivered in a face-to-face approach. Definitely there's possibilities for a hybrid model through the project that we delivered.
Okay, thanks, Julie. Anybody, Aisling, would you like to comment on that? What do you see as the best way forward?
Yeah, thanks, Catherine. Yeah, I agree with Julie. I think a hybrid model would be interesting. I suppose the projects that we've delivered over the last year have really shown the success of the remote delivery in terms of the engagement and reach of families. I suppose there was over 100 families supported in Galway City in 2020, whereas if we had went with the face-to-face delivery, 20 would have been the maximum amount of families that we could have engaged with through the delivery of 2 face-to-face programs. So I think the delivery in terms of the remote piece and engaging the whole family, and also maybe to have an event at the end where the families come together, share their learnings, and that there's kind of the education piece built in throughout as well. So I think there's a bit of work to be done in terms of figuring it all out, but I definitely think there'd be great benefits for the hybrid model in terms of continuing on with that remote piece and engaging the whole family, but also to have ensure that the education piece is built in throughout and incorporate the face-to-face element then as well.
It's going to be interesting to see the actual number of families that have benefited through all the projects this year through the online model versus the physical resources that we normally have. Sinead, you wanted to step in there?
Yeah, I suppose I'm in the lucky position that I'm dealing with all of the community food initiatives around the country, and I could see like elements of different projects coming in, so that maybe you'd bring people together to do cookery programs, but you'd still have a WhatsApp group so that when they go home they can talk to one another, or we'll do the remote one because, say, you know, people who are living in remote areas, they can't come into a centre, so it would be great to have a cookery course online. So I'd say, just going by the initiatives that I've seen over the last year, we're going to have a lot of different models that people can learn from. So I'd say next year it's going to be really interesting to see how people work.
Thanks, Sinead. And Marta, you wanted to come in there as well.
Yeah, only to let you know that we are always in Foroida. We have a kitchen in or near our office, and we are always using the cooking and these type of activities to encourage the people to develop the skills. The chats are always easy in front of a cup of tea or a hot chocolate, and we are always encouraging them to cook for the others, to care for the others. And there is always something sweet, maybe pancakes for everybody, and I think we are going to follow this lead as well, and maybe reading to the families, or maybe it's a way.
Okay, thank you, Marta. Fionnuala, did you want to step in there?
I think with COVID, blended learning is a big thing. So blended learning, blended working. So a lot of things have changed. So a hybrid would be good for us yes, we work in community setting, will come to the community setting, but with delivering the program at home, the whole family's getting involved, and they're being left with ingredients, a lot of store cupboard ingredients and ingredients that they probably wouldn't have bought otherwise unless they were doing the program. So they're left with a lot of resources to make the meal again and again and again. So yeah, time intensive, working, doing it online, but it was fantastic for us. So it really was fantastic, and it has created more of a sense of community, especially with what was being discussed on the WhatsApp groups. So it would be both for us.
Okay, thank you. And I mean, so this is all very positive. Were there any negatives coming out of it, apart from the kind of Zoom fatigue? Were there any other major negatives? And the other part of that, I suppose, that's related is in terms of, I think it was Julie was talking about participant retention and how that can be. Is that positively or negatively affected by the online forum, or how can that be ensured going forward?
I think if you discuss and if you let the people know what's expected, of us as the delivery and of them, we had 100% retention, and it was like they couldn't wait every week, find out what was being cooked that week. So for us, it was 100%. Yeah.
Okay, thank you. There's questions flying in here now at this point. Some of them are quite specific in terms of, Fiona Maloney here is asking, can you explain how the evaluation data was collected? Julie, I think this is probably to you. Were participants sent an email link? How did you encourage completion of the evaluations?
So at the start of the program, when participants signed on, we had put all our registration forms on SurveyMonkey, which then collates all the data when you download it, and they Excel, so you can actually extract the data and then put it on the graphic form if you need to present it. But again, they incentivize post data collection. We had given them incentivize. We encourage families to complete them, and then we would give them a final food voucher on completion of the survey to help with a family food shop then on completion of the program.
Thanks, Julie. And there's another question here in relation to the evaluation. In relation to fruit and vegetable portions and shopping lists, how did the results compare with available national information? I guess your sample size was quite small, so it would be...
Yeah, it was quite small. There was only 20 families involved, so it was only the key parent that would have completed that, but I'm still doing a bit more information, so to compare to the national areas, I would still need a wee bit of time to see how that would compare nationally.
Okay, thank you, Julie. There's a question here about the Zoom sessions. How long were the Zoom sessions? Did you design the 6-week online program or use one which was already developed? This question's from Lisa.
The Zoom sessions, well, mine particularly were between an hour and a half. I never wanted to run any too longer, but we give the participants kind of a schedule each week of how long the session would be and then what they would be receiving each week in terms of resources or food. So they kind of knew what they expect when they tuned in and the planning. So we structured ours around the food value. So we had a set structure, but we just created the online content slightly different from the manual itself, from our experience of delivery.
Okay, and there's a very interesting question here from, it's disappeared now, but it was about the evaluations. And is there an evaluation 3 to 6 months down the line to see what behaviour is like on an ongoing basis? Because this is a really key question with the CFIs in terms of the ability to change behaviour, not just for this kind of the 4 to 6 week period, but on an ongoing basis. Would anybody like to step in and have a go with that? Sinead, you might have some.
Yeah, I suppose we're kind of trialing it last year, and this year now we're rolling it out again. So it'll be interesting to see like the comparison between what happened last year and this year, because I suppose the groups have kind of learned how to work it now, and I suppose how to act to activate people and to get them involved and then to get the evaluations. So I'd say we'd have to wait until the end of this year to see, the comparison between the 2 years.
Okay, thank you, Sinead. I just have a couple of questions here that occurred to me as we were going through, which I think one is around sustainable healthy eating. Julie, again, you mentioned the Eat Well guide, and I think one of the speakers mentioned about environmental impact. Was that an issue with participants, or was that something that you considered as you were developing the programs. And the other one is about snacks. Like a lot of the work seems to have been related to main meals, but in terms of kind of awareness of healthy snacks and using milk and water as opposed to fizzy drinks, was that an aspect of any of the initiatives?
On the terms of sorry, Sinead.
No, far away.
Just in terms of the snacks, it was touched upon in terms of our meal plan and our Eat Well guide sessions.
Yeah.
Just in relation to the foods that are high in sugar and fats and salt, being outside. Like, yeah, we had a great discussion around what those be in terms of our snack culture tends to be around what's not supposed to be in our Eat Well guide, and we discussed that and highlight that to parents and give them the support that way. And then we tied in the meal planning. So we had a section in our meal planning session regarding snacks and how families can plan for that. And we thought, and I think parents found that most useful because it ties in the more school lunches and school meals and post-school time. So they found that very helpful in terms of meal planning.
Right. Did anybody else want to come in there in terms of snacks or sustainability?
I was just going to say, Catherine, especially during the live sessions, they kind of used the opportunity to introduce different topics. So they would have chatted to people about snacks and, what are you doing now and what should you be doing and how you change things. And I think the portion plates were really good at kind of introducing people to the whole topic of how big a meal should I be giving my child, what should be on the plate, in terms of the healthy options as well. So I think it was a great opportunity for people to kind of just chat and hear what other people are doing, and especially during lockdown when people were kind of eating more just to kind of occupy themselves. They kind of reinforce one another and say, well, this is what I did and this is what worked for me. So there was benefits there as well.
Thanks, Sinead. And there's another question coming in here about how will you as facilitators of these programs, have you learned from each other in this session in terms of future initiatives and going forward and how you might change things? That's something that
I think for us delivering the first program, so we did learn every single time with our delivery, and also even working with the other organisations who've been delivering either a food values program, not just through CFI, but through other funders. We've all learned from each other. And even just going back to the last question, when you were talking about snacks, etc., and Eat Well Guide, the Food Values Programme, which is a forum which was produced by the Health and Social Care Trusts in the north of Ireland. All these areas are threaded through the programme. So you do look at snacks, you do look at drinking. There's a lot of resources that we add every single week. So there's a lot of information that's passed on to the participants. So there is.
Okay, great. And I suppose just to get there's a question here about, again, what worked well, what could have worked better in terms of offering vegetarian options, for instance. Was that something that you were very conscious of, or having gone through the experience, are there any of you that are looking at the next program thinking, well, this is the way we're going to do it based on what maybe worked well or didn't work so well this year? Julie, you want to come in there?
Sorry.
Or Aisling?
I was just going to say, in terms of overall, I think there's more things that worked really well. I know Phil touched on it. It can be time extensive for the work to be involved, but I think hugely the programs that we've presented, I feel, have worked massively well in terms of the impacts received and how we've helped families. I think going forward, I myself are just looking at more practical options and how we engage. So we're looking at portion size and how we can break that further down for families and engage that way. But hugely, I don't think there'll be much that could be changed that will make it hugely better, but probably just adding that more practical and helpful resource.
Okay, and as part of that, I think Claire Hamilton is coming in here with a question, were there issues around digital poverty and individuals not being able to take part in sessions that required an internet connection? There's a couple of questions in relation to technology and the internet. Did anybody have issues around that with?
I had no personal feedback that parents had. Now, when someone signed up to the programme, we followed up with a phone call just with a basic requirement that's what would be involved in the programme. Would they need would they have a laptop or a smartphone available? Do they have internet connection, and can they access Zoom quite easily? And we again provided any instructions needed to help get them connected, but there was nobody that couldn't connect. They are programmed, thankfully.
Okay, great. And there's a very good question here from Grania about food hygiene messages and kitchen safety incorporated, as these are usually an essential component of healthy eating and cooking programs. That didn't really come out, but I know that many of you had food hygiene messages included in your programs. Does anybody want to address that?
That would be an important feature of the CFI. It's one of the themes, is to encourage food safety. So that would have been incorporated into a lot of the sessions, you know, and especially when meat was being used, you know, in terms of washing hands and using different boards and things like that. So that would be part of the program as well.
Okay, and in terms of the programs, were there any additional supports that would have facilitated the rolling out of the programs? Any additional supports from Safe Food or other organisations that you would have thought that would be really good if we could include that in the programs? No.
I think the resources that Safe Food provided were great. The 101 Square Meals book for us was fantastic because that was just delivered at the first week of every single program. So we didn't need to photocopy. The other photocopies and paperwork would have been the evaluations and the GDPR and that was all additional, but that was our own stuff as an organisation. But the resources, the meal, the portion plates were great, you know, and the other bits and pieces that we even picked up from Food Standards. Food stuff was fantastic for us. The sugar displays, the sugar cereal poster, the A3 poster, all those bits and pieces were great. And the parents, it was great conversation and conversation, you know, people were able to compare and discuss what they did, what worked best for them, what doesn't work for best, and also just how to eat have a healthier style with using these resources and discussing it between each other. I think the peer-to-peer work online was great with the help of the resources because it was a good topic of conversation. So it was.
Okay, great. Yeah, there's a lot of interest in the portion plates, and I see a few questions coming in about how widely available they are. So if you can direct those questions to Safe Food, we can address them. There's also a question coming in there from Cara about what digital poverty and urban-rural cover. Again, I know that's a key issue for many of you in terms of ensuring urban and rural cover. Does anybody want to address how your demographic in terms of how you were spread rural versus urban, and whether that was an issue in terms of digital poverty?
I think that's why there was such a difference in the way the CFI was rolled out around the country. You know, especially in the rural areas, they didn't do live Zoom sessions, and they gave people links to the Safe Food YouTube videos and things like that. So I suppose each area looked at what was going to work for each of their participants, and then, you know, developed the CFI around that.
Okay, great. Well, I think our time, unfortunately, is up, so we're going to have to bring it to a close. Thank you all very much for the really informative and the kind of the innovation and the creativity is what is really striking me, as with kind of very basic resources and minimal resources, you have rolled out programs that are so beneficial and effective in these really challenging circumstances. So I'm just going to say thank you once again, and I'm going to hand over to Anne Parle, our technical executive, to make some closing remarks. Thanks again.
Hi everyone, and thank you, Catherine. And firstly, I'd just like to say a big thank you to all of our speakers for their time and their fantastic presentations this morning. And thank you to each of you who have joined in and taken the time to tune in this morning. There's been some fantastic discussion as well. The webinar has highlighted just a small selection of the fantastic work that community organisations are doing. And I would like to also thank and highlight the other organisations involved in the current Community Food Initiative programme and those who took part in the CFI at Home programme and Transform Your Trolley projects. You've all adapted during extremely difficult times to support your communities, and the results speak for themselves. The projects have had a reach and impact outside just simply promoting healthy eating. You know, we've heard about how the programs gave participants a chance to connect with their families, the wider communities, and build relationships, and giving them just something different to focus on during a very difficult time. And just to reiterate what Catherine has said, you know, we've seen fantastic creativity and innovation from all the CFI leaders, and I know ourselves at SafeFood and CCAD are looking forward to seeing what the year ahead brings and how the projects develop based on what we've learned. There's a lot of valuable lessons to be learned, and that will definitely shape everything moving forward. Just a brief thank you as well to everyone behind the scenes who made this all possible. We will be emailing you a short survey on today's event, and we would be grateful if you could take a few moments just to complete this and provide some feedback. And just to mention as well, the presentations will be available to view on the CFI event page after the event as well. So thank you very much and enjoy the rest of your day.